Good morning, Dr. Chua. My name is Norina. And now let's discuss to the first question, which is about a 55 years old college lecturer who persists of chronic pain at the neck and shoulder for about 2 years and never go to any physiotherapy treatment. So for the subjective pain assessment, the suitable assessment for the patient is first is a numeric rating scale, which is NRS. This NRS is considered a gold standard and suitable for clinician to evaluate the pain. And it's important for us to know the severity of the pain and also to know the chances of pain after the treatment. So we can see either the deviation is good or not, or it's still the same. So while asking to the patient, we have to let the patient know, okay, from 0 to 10, how much is the pain. So like saying 0 is no pain at all, 1 to 3 is considered mild, 4 to 6 is medium, and 7 to 10 is worst pain. So ask the patient, what is the rate of pain during that time, during at rest, and during movement. So what movement causing pain? So we have to rate the pain. Okay, that is the first one. Second is DN4, which is to know the probability of neuropathic pain. So this is a yes and no question. So we have to know is the patient is having either have another characteristic of pain besides than having numbness. So for the first and second question is about the subjective pain assessment, and the question 3 and 4 is about examination of the pain, which is relating to the objective pain assessment. Okay, for the question 1 is like, for example, the question, does pain have one or more following characteristic like burning, painful cold, and also electric shock? So the patient need to answer yes or no. So next question is question 2, also related to subjective question, pain assessment. Is pain associated with one or more following symptom, like for example tingling, pin and needles, numbness, and itching? So the patient also need to answer either yes and no. And the third question is about more on objective assessment, like for example we have to look for any hypersensitive for the touch, touch, and also to the pinprick. So we have to touch the patient and also to pinprick using like pepper clips, so to look either the patient is having symptoms or not. So if we just test at the local area, so where the pain is, so we just test over that and then ask the patient. First is either the patient is having hypoesthesia to touch, and second is hypoesthesia to pinprick. So if the patient is yes, so just type yes, and if no, it's no. And the question 4 is about, in the painful area, can the pain be caused or increased by brushing? So we have to brush at the local pain area. So do the brushing and ask the patient either the patient is having symptoms or not by brushing. So that is DN4 questions. So the first 2 is about the subjective pain assessment. The next 2 question is the next 2 question is about the objective pain assessment. Okay, other subjective pain assessment that can be used for the patient is pain disability index, which is more suitable for chronic pain, which is used to measure the degree of how severity of the pain that may influence to the daily activity, how disrupted the patient with the chronic pain. So they have numbering from 0 to 10 also, like 0 is no disability at all, 1 to 3 is mild disability, 4 to 6 is moderate disability, and 7 to 10 is the worst disability, maximum disability due to pain. And then they are questioning about the 7 issues. Is first about the family and home responsibilities, which is relating to the house chores. Second is about the recreation, about the hobby. And the third is social activity, like going out with the friends, how is it? And then the occupation, either it's disturbing work or not. And we have to know that if the patient have relating, if the patient is make the patient have to stop working or how. And then the fifth question is about the sexual behavior, how frequent the pain disturbing the sexual behavior, and or how much the sexual behavior, how much the frequency of sex have been reduced due to the pain. And then next question is number 6, which is about to self-care, which is dressing, bathing, showering. So how much disability or discomfort causing due to pain. And the last one is life support, like for example is sleeping, eating, breathing. So how much disturbance to the patient. So these 7 questions is to measure the degree of life, how much has been disrupted due to pain. Okay, next for the objective pain assessment. Besides than the question 3 and 4 of DNQ, DN4 questions, we can also look for the observation. So we have to observe the facial expression, either the patient is grimacing or the patient either in a relaxed posture, in a relaxed position, the face is okay, the posture is not either the face is okay or the posture of the patient is not restricted due to pain. So that's just a few things that we have to look into based on observation. Okay, next is we also have to look, besides then facial and also posture, we have to look for the guarding area. Like for example, if the patient is having pain of the neck and also having pain of the shoulder, so most likely the patient usually tense this area. So this is something that we have to look into. So if the patient is in tense position or not, and the patient is holding hand or not, because to secure the pain and was afraid to move. So we have to look to look of that possibility as well. And if the patient is okay to move actively, and look for the facial as well, and also during passively. And also last one is we have to look for the breathing. So in terms of patient able to breathe normally, or they are using accessory muscles due to pain. So they have tense their body, so they have to use the accessory muscles. So that's a part of the sub-objective pain assessment. Besides that, we have to look for another test, like for example spelling test, UNT test. So this also need to rule out, because we have to know where the pains come from, so that it's quite easy to treat the pain. Okay, for the next question, which is question 2, is about 48 female who are having pain persist for about 2 or 3 months. So this statement shows it is an acute pain and also have difficulty in movement, and it seems have shoulder and also neck full range of motion. And this statement shows that the patient is having fear to move. It's quite difficult to access because the patient is having fear to move. And the last one is throughout the physical examination, they showed a positive impeachment test and also negative spelling test. So it shows that the patient is having shoulder pain, shoulder problem, and not relating to any neurological issues. Okay, for in terms of the pain education treatment, what can we do to the patient is, first we have to explain to the patient that neck pain and shoulder pain is not necessary, is not equal to damage to the structure. So we have to explain to the patient that the structure is sensitive. For example, giving example, like for example, if a car have a sensor at the back, so when we when we do the reverse, of course the car will alarm, like the sudden alarm, because we want to alert the passenger, to alert the driver. because there's something at the back there. So it says that this shows that the alarm is a danger, a system to tell the patient that you are having danger. So but if the patient if a car is consists of an alarm at the front, side and backwards, and if it's going on the street, so of course the alarm will sensitive at the front, at the side, at the back. So it shows that it's more sensitive. It's quite difficult when the car is too sensitive. So the driver is quite difficult and cautious to move, to drive the car because of the alarm system. So it causes more anxious, cause depression, which cause afraid to move. So this is similar to the human body. Like pain is just a signal to the brain. Okay, it shows a danger, but unnecessary of too much of awareness, too much of this conscious will lead more pain. So this is something that we have to tame the signaling by encourage the normal activity. So just do the movement as usual, even though it is pain at the very beginning, but it will subside as we usually active. Just do the normal neck movement, sideways, going up and down, and also shoulder movement. So do the very basic movement so that can still the movement is still there and do not become worsened by time. Next is encourage the relaxation. For example, is breathing. So if most likely the patient is, if they are having neck pain or shoulder pain, they are tense over this area, so they use a lot of accessory muscle to breathe. So we have to encourage the breathing using diaphragm so that it can more relax on the upper sides. And also we have to facilitate awareness tension. So like the patient is having neck pain and shoulder pain, more tense on the upper traps. So we have to aware, and we have overactive of the upper trap. So we have to always aware to the patient, so to relax the upper traps, to relax, and also to encourage the posture education to the patient, and also to breathe as normal. This one is need to be relaxed and normally sitting. So that is a few pain education to the patient. And next is to encourage the mobility exercises. So the reasons for promoting the mobility exercises is to normalize the movement impairment. So this is to make sure the body is preserved and do not worse by time, and also to change the lifestyle, like for example, as while do the light stretches while doing work, ergonomic posture, and also take a balanced diet, and also meditate, to do like simple exercise like yoga, tai chi, to have a lot of relaxation, and also to improve the mindful state. Okay, the next question is the pain intervention. So as a therapist, what can we do? Besides than pain education, is we can do joint manipulation at the shoulder joint. Maybe with we can access first. So either it's related to the pain or it's related to range of motion. So we look for which grade is suitable. Grade 1 and 2 is for pain management. Grade 3 and 4 for range of motion management. So look which one is suitable to the patient. Next, we can do the strengthening exercise for the rotator cuff muscles, as the impingement range of motion might lead to weakness of the rotator cuff. So we have to give strengthening exercise on the rotator cuff muscles, and also to stretching the neck. So to stretch as much as you can to all movement, and also for the posture education, to always sit straight in erect posture, and to make sure if for example if reading, so not flexions too much, should not look down for too much, but make sure when we are doing reading or doing computer work, make sure the eye level is similar with the materials or stuff that we look at. Okay, I think that is all from me. Thank you.